Welcome to The Coalition. This is a talk show dedicated to discussing health, wellness, and inspiration. I'm your host, Dr. Shani Belgrave. Hello, everybody. Welcome to The Coalition. I'm your host, Dr. Shani Belgrave. I am a minimally invasive and bariatric surgeon in Atlanta, Georgia. You can reach out to me and connect with me online at www.drshanibelgrave.com. I am grateful and excited to have on the show with me today Dr. Iman Hypolite. Dr. Hypolite is a psychiatrist who's here to talk with us right on time for Mental Health Awareness Month. She's going to be speaking with us about anxiety and depression. Dr. Iman Hypolite, welcome to the Coalition.
Thank you. I'm happy to be here, Dr. Belgrave.
Thank you so very much. So I'm really excited about all the great information you're going to be sharing with us. So before we get into that, can you please tell us who you are and your area of expertise?
Yes. Hi, I am Dr. Iman Hypolite, and I'm a double board certified psychiatrist, and I specialize in women's mental health. I treat high functioning anxiety, high functioning depression, and professional burnout in professional women of color, ages 25 to 60. I'm licensed in 18 states, and I provide all of my services online. And my practice is named Aspira Health and Wellness. I started it about 2 years ago, and it is a great space to be in right now. And I'm happy to be here to talk about mental health with you.
Fantastic. So I know with mental health, there's a whole spectrum of different disorders. Anxiety and depression are very prevalent, very common. So that's what we were going to be focusing on today. Can you kind of give some education on what are the signs and symptoms of depression and also anxiety?
Sure. And so there's a lot of overlap between depression and anxiety. Of course, there's separate conditions, but there is a lot of overlap. So when someone has depression, there are different forms of it, different severities of it. And so there's major depression, and that's the one that's more clinical, that oftentimes requires more intensive services, and that generally generates a diagnosis when you go to see someone. Then there are milder forms of depression, where depressive symptoms might last a couple days, or even hours, as opposed to weeks at a time. And so depending on how long the symptoms last, how severe they are, that will garner whether or not it'll can be considered clinical or just a normal kind of presentation for what might be going on in one's life at a given time. And so it's important to distinguish that not all depression is actually an illness, or a disorder or disordered. And so in terms of major depression, the clinical depression, common symptoms could be loss of interest in things that were previously enjoyable, low mood, sadness, irritability, changes in sleep, whether trouble falling asleep, trouble staying asleep, or sleeping too much even, changes in appetite, such as increase or decrease appetite, or sometimes craving things like carbs and sugars, as well as low energy, difficulty concentrating. It can be loss of libido or decreased libido, as well as thoughts of not wanting to live anymore that can progress to thoughts of suicide. In terms of anxiety, you'll see there's a lot of overlap. It could be feeling worried, having difficult to control worries, just worried thoughts, just cycling through frequently, feeling on edge, trouble relaxing, difficulty concentrating, low energy, changes in sleep, either difficulty falling asleep, difficulty staying asleep, or sleeping too much, changes in appetite. It can be also physical symptoms like stomach pain, change in bowel habits, abdominal pain, just aches and pains throughout the body that are not attributable to physical health conditions. That could also be signs and symptoms of depression and anxiety. So there's a good amount of overlap there, but they are common, increasingly common, it seems.
Wow. That's really useful information. Thank you so much. So given how all of those things can make life difficult, especially with, you mentioned being on edge, problems with sleep, craving certain things. What are some things that you would recommend that we can do to improve our mental health?
Sure. I mean, it's really the basics, but they're very powerful. So getting enough sleep at night is really, really important. So good sleep hygiene, turning devices off, an hour or two before you need to go to bed. Getting anywhere from, it varies, from individual, from person to person, but on average about 8 hours for most people. And so trying to start your bedtime routine so that you're getting good sleep. Sleep is essential to maintaining healthy stress levels and maintaining a healthy mood and a stable mood. Also, exposure to sun is important. A lot of us, are working indoors and, in buildings and don't oftentimes get the exposure to sun that we need that can, help release some of the natural kind of antidepressants in our body that help maintain mood and help with stress levels. Diet is also important. There's increasing studies about the role that diet plays, as well as gut health plays in depression. And so what you eat is really, really important in terms of, how you maintain your mood, stress levels, concentration. Mediterranean diet is one of the best diets. It's been studied quite a bit in terms of having benefits for mood and mental health. But generally, a low sugar, high protein, low preservative, as fresh as possible, that can help quite a bit. Other things like spending time around people you care about, not isolating. Loneliness and isolation have been on the rise, and that's also significantly associated with mental health, whether that's depression, anxiety, as well as risk of dementia and Alzheimer's. Other things, like making sure you're taking care of your physical health, getting your checkups, because there are other things that can cause depressive and anxiety symptoms like thyroid conditions and anemia. And so making sure that you're also doing your annual visits and getting that lab work and taking care of any imbalances or nutritional deficiencies or vitamin deficiencies that might be present. So those are just some of the basics that can really help. And I know that when times get stressful, it's kind of hard to do those basics, but exercise is another one. So it's really those key tenets of self-care. Self-care has become a buzzword, but there actually is something to it in terms of its preventative effects.
Absolutely. I couldn't help but smile because as I've been doing these shows, there's so much overlap, between the heart, between the colon. A lot of the information has been overlapping in terms of, really minimizing processed foods
Mhm.
and sugars because those things are just bad for us overall. And of course, our mental health
Exactly.
is a part of who we are. So thank you very much.
Mhm.
Another question for you, Dr. Hippolyte.
Sure.
What would you say when counseling patients, that I may come into contact with who have anxiety, who have depression, when would you say someone should see a psychologist versus
Mhm.
a psychiatrist?
Good question. Good question. And so I'll start with the psychologist. Psychologist specializes in talk therapy, and some psychologists also will do testing, different type of psychological tests to clarify diagnosis or to even test for IQ and intelligence, like for school or for certain jobs. And so their main kind of modality or tool for treatment is talk therapy. Whereas a psychiatrist goes to medical school. And so they learn about mental health from a different angle, more so a medical model. And so we not only learn therapy and do talk therapy, but we also learn about that interface between physical health and mental health. And so we learn about the physical health conditions that can manifest as mental health conditions. And then we also generally treat a wider range of mental health conditions. And so in addition to talk therapy, we also prescribe and do lab tests and have a medical model in addition to a more cognitive and talk-based model and form of treatment. There's also master's level therapists. They're not called psychologists or psychiatrists. They tend to be called counselors or therapists, and they specialize in therapy as well, but they've just not had as intensive training as psychologists. And so there's kind of three different kind of entry points to mental health.
Hmm. And when you talk about talk therapy, is that the same as cognitive behavioral therapy, or are there different types of talk therapy?
Yes, so cognitive behavioral therapy, or CBT, is a form of talk therapy, and it's one of the predominant forms of therapy that's used today. It's one of the ones that are, just having increasing amounts of evidence to support it. And there are lots of different branches of CBT. So there are all kind of branch offs of CBT, whether it's DBT or mindfulness-based cognitive therapy. There's a form of therapy that's kind of like coaching called ACT, acceptance and commitment therapy, and all of them have their basis in CBT. And then there are other forms of therapy that are not CBT, and they're more of like the old school therapy that you think about, like, or that a lot of people think about when they imagine lying on a sofa, not facing the therapist, and that's more psychoanalytical. And that was years ago, that was like the foundation, like that was the initial original form of therapy. And people would sometimes go to see their therapist multiple times a week, be in therapy for years. The newer therapies are much less intensive, and shorter in duration in terms of frequency of sessions, as well as generally the amount of time that you're spending in therapy. So they tend to get straighter to the point than the older forms of therapy.
Do you know, Dr. Hippolyte, I was just wondering if someone was seeing somebody for anxiety or
Mhm.
depression and using cognitive behavioral therapy. I'm sure there's probably some variation, but is there an average amount of time that someone may expect to need to go through that sort of therapy before they really feel better?
There's no way to really predict that. Oftentimes, like in terms of the standardized studies, oftentimes they're studied anywhere from 6 to 12 weeks, but that oftentimes doesn't play out in clinical practice, and therapy can oftentimes go longer than that. But generally, at least a couple months, someone should budget for, and oftentimes it's considerably longer. And so there's no way to predict that, because the severity of symptoms, other things that might come up in addition to the symptom that they presented for. Um, just everyone has their own unique kind of set of challenges and strengths and challenges that they presented therapy with. And all of that determines how long they might be in therapy, as well as the form of therapy that is taking place that can also play a role.
So I know you had mentioned that sometimes people, depending on what's happening in their life, may have anxiety or depression. It doesn't necessarily mean that they have clinical depression or something that
Mhm,
needs treatment.
mhm.
Um, but the other side of that coin, I would say, is if someone does have clinical depression, would you say that that's a chronic condition, or is that something that really can be resolved and they no longer have depression? It's just that they had a history of depression.
Sure. There's no cure for any mental health condition. Um, and so that's one thing that's a bit different on the mental health side than the physical health side. But someone can present with symptoms where they're clinical, they're causing a lot of issues and concerns, just very active symptoms that are very impairing at a given moment of time. With treatment, those symptoms can become very manageable, to where they may just have to, instead of being on meds, or instead of being in therapy weekly, or every 2 weeks, they may only have to check in with their therapist periodically as symptoms kind of emerge.
Needed.
And so um, once someone has generalized, has a generalized anxiety, or has exhibited a tendency, or has had an episode of generalized anxiety disorder, their chances of having another one are fairly high. Not every, doesn't mean that everyone's going to have a repeat episode, but there is no cure, but it is highly treatable, highly manageable, and oftentimes those symptoms can be manageable and caught before it merges into more clinical symptoms again, with good self-care and maintaining a relationship of some sort with a mental health professional.
What would you say is the role of the primary care doctor in treating anxiety and depression?
I think one of the best ways that we could all partner is with primary care doctors being a major source of referrals. And so understanding when it's time to refer out is really, really important. I find that oftentimes what happens is that given that most primary people are seeing their primary care doctor once a year, someone might come in really stressed out or maybe feeling really low and depressed. They'll see their primary care doctor get started on the starting dose of an antidepressant, then they won't see that doctor for months at best, might be 6 months, might be 12 months. But during that time, there's been no adjustment of the dose. And so oftentimes it's not effective at the lowest dose. And so then that person has in their mind, oh, you know, mental health medications don't work. Well, it's not, it's that it hasn't been monitored and titrated, or you haven't checked in frequently enough to see if there's side effects. And so psychiatrists and therapists we see our patients much, much more often than the average physician. So a psychiatrist might see their patients anywhere from once a week to, once or twice a year. And generally, for me, on average, I'm seeing my patients once a month. Oftentimes, it's much more frequent early on. But that gives us the opportunity to closely monitor those symptoms to make sure they're responding well to treatment, that there are no side effects. And so in terms of where primary care doctors could be the most effective, I think because there's such a shortage of mental health providers, particularly psychiatrists, I think it's fine for them to start an antidepressant, but then to refer to someone who can more closely and effectively monitor the symptoms, because we're seeing an uptick, especially like with ADHD, like of just the medications being prescribed, but they're not being monitored appropriately. And so there are people walking around thinking that meds don't work or therapy doesn't work, and they've just not had the right handoff and the right intensity of care. So I think primary care is great to identify symptoms, to even initiate treatment, but then also to refer out. I do think that referring out is more times than not going to be the best bet. And if that can't happen, then making sure that you're seeing mental health patients more often than you would someone without active mental health symptoms. It's going to need to be more frequent than every 6 months, probably at a minimum every 3 months to really effectively treat people's symptoms.
Okay, well that's really good information. Thank you. I was
Yeah.
just thinking about some of the stuff we talked about with mindfulness and cognitive behavioral therapy. Do you have any exercises that you would say somebody watching this, if they're feeling like they're getting anxious, or if they're feeling something internally that you can recommend or that you use to kind of recenter and kind of change their thoughts that may help?
Sure, there are a lot of techniques. There are increasing amounts of resources and digital resources online. Guided meditations can be very, very helpful, especially for someone who is new to mindfulness or new to meditating or has a hard time doing it on their own. And so YouTube has a ton of videos where someone is actually talking you through what to do or where to focus your thoughts. And that can be a really good introduction to mindfulness. And mindfulness is not just meditation. Meditation helps with mindfulness. Mindfulness helps with meditation. It's just one of the many tools that fall under mindfulness. There are also workbooks that can be found online, where someone can work through, depending on what symptom it is. There are a lot of symptom-based or condition-based workbooks that someone can find. In addition to things like deep breathing exercises can really help in the moment when someone is stressed out. So there are many strategies that can be helpful in terms of helping maintain normal stress levels, because stress is a normal emotion. Anxiety is a normal emotion. It just, when it starts to get impairing and really interrupt one's day-to-day life and their well-being, is where it becomes clinical. And one of the things I really love to stress is that therapy and even seeing a psychiatrist is not just something that should be accessed when something is wrong or when someone is ill. The best way to engage with mental health really is from a preventive strategy. And so if you're noticing that you're starting to get an uptick in stress, that's a good time to engage with a therapist to start learning those stress management skills early on. if you're in therapy and those symptoms are starting to just, show up every day, and even starting to get physical, and that they're impacting your sleep or your appetite, or getting in the way of your productivity or your ability to engage with your loved ones, and therapy isn't good enough, your self-care isn't good enough, it's just not cutting it, that's when you should see a psychiatrist. As opposed to what I see is oftentimes people wait until they're at the point where they need to lose their job, or they have to leave their job, or the symptoms are so severe. And when you wait until when those symptoms are so severe to where you can barely get out of bed, or you don't have the energy to engage in self-care, at that point it's going to take much longer to get back to your healthy kind of baseline. It's going to take more intensive treatment, whereas you might have been fine with some supplements or just therapy, but because you've waited and the symptoms have gotten more severe, now you might require medications, or if you wait long enough you might need more than one medication, or more strong medication that has more risk of side effects. And so one of the things I'd love to stress is engage with mental health care before things get severe, before they really get in the way of you living a life in a healthy way, and your well-being and your quality of life and level of functioning really get impaired. Start engaging as when you start seeing the signs, as opposed to when they're overwhelming.
Wow, that was really something to think about, in the sense that it's like that with so much of our health, is that when something starts off, if you intervene early,
Right?
oftentimes you can keep it from blossoming into something much larger that can then be a lot
Exactly.
harder to contain. So
Exactly.
um, that's
Hmm.
great to really encourage people, if you feel something or there's something going on, not to be reluctant to seek out these resources.
Yep.
So the other thing that I wanted to make sure I asked you about is if you have any resources, or what should someone do if they either are in crisis, thoughts of harming themselves, or they know of someone that's in crisis. What would you say is the best
Sure.
number, hotline?
Yep. So there's a national hotline that is really easy to remember. It's 988, and you can call or text this number. It's a national crisis line, and you can call or text the number 24 hours a day, 7 days a week. They're trained professionals who can help with talking you through whatever you're experiencing at that moment, getting you to safety if need be, as well as helping you find resources in your area. So 988 is a really good number. It also has a separate line for veterans, and it's all connected. And so it has a number of branches depending on what your need is. It can help. There's also one specific to Georgia. The Georgia Department of Behavioral Health has a number as well, and that one is 800-715-4225. And that line can help with people in Georgia to get them appointments to services, as well as send out a crisis team if need be.
Wow. Well, thank you so much, Dr. Hippolyte. You covered a lot of ground in a short amount of time. I want to thank you so much for joining the coalition. What is the best way for people that are interested in speaking with you or getting a consultation? What is the best way for them to contact you?
I'd say the best way is my website, and that's Dr. Hypolite. That's DRHYPOLITE.com. You can request a consultation there, as well as find details about the services that I offer.
Wonderful. Well, thank you so much for joining the coalition, Dr. Hippolyte. There's a lot to discuss when it comes to mental health, so hopefully you'll come back another time.
Absolutely. I'd love to. It's been a pleasure, Dr. Belgrave. I'd love to come back.
Thank you. All right. Thank you guys so much for tuning in to another episode of The Coalition. The goal of this show is to really empower everyone so that we can live our best lives. So please feel free to contact Dr. Hippolyte. Also, feel free to look into the things we discussed today on mindfulness, and learn a little bit more about anxiety and depression. If this is something that you are dealing with, or a friend or loved one, make sure that you share this episode, share this information. As for me, you can reach out to me online at www.drshanibelgrave.com. Thanks so much, everybody. I'll see you next time.